Hi, I'm Brian Finestein, CEO of St. Clare's Health. Welcome to Let's Talk Health. I'm here with Dr. Fazal Bari, Medical Director of our Oncology program. Welcome, Dr. Bari.
Thank you.
Our topic today is individualized cancer care. So, patients are getting a diagnosis from their physician that they have cancer. Very, very difficult diagnosis for people to accept. But one of the questions that are coming up is, how much is the treatment designed for the particular diagnosis, and how much of it is for the individual patient?
It's a great question to start off with. I'd say the biggest strides we've made in the last 5 years, and it's getting quicker and quicker with the progress that we're making, has been focused on treating the individual patient more than the diagnosis. We always knew that lung cancer and colon cancer and breast cancer and prostate cancer all were treated differently, all behaved differently, all spread differently. We also knew that within a specific cancer type, if you took 5 patients with lung cancer or colon cancer and you treated them all the same way, they might all do quite differently in terms of how well they responded or didn't respond. But we never had a way to differentiate or identify the unique things that would predict how well they would do with a certain therapy. Now, as technology has permeated every aspect of our lives, and medicine's no different, we're able to find the genetic code that many of these cancers carry that allows us to target specific areas or specific aspects of the cancer growth to help a specific patient.
Now tell me, can you give the audience a little bit of a sense of the new diagnostics that are out there that help specify that individualized care?
Yeah, so diagnostics, we can start with the quality of our imaging, our CAT scans, MRIs, 3D mammography, how much more they pick up. Down to the way we diagnose cancer. We are coming up, hopefully within the next decade, to maybe even get to a situation where we'll be able to make diagnoses through the blood and not have to do tissue biopsies. But where we stand now, after we get a sample of tissue and we look at it under the microscope and we establish a diagnosis, we're able to then take the genetic makeup of that tissue, that specific genetic footprint of that individual's cancer, and find out what is the driving mechanism behind that cancer. And thereby we're able to figure out what medications can exploit that driving mechanism and control it without causing too much in the way of collateral damage like our traditional therapies would do, where they would generally just kill rapidly growing cells. Cancer cells grow rapidly, but then anything in the body that grows rapidly, like your hair or your bone marrow, would be subject to side effects.
Okay. Now, could you tell us also about some of these new technologies? I know that people are undergoing different forms of chemo. There's different types of radiation. Could you expand on that a little bit?
Yes. So, if we were to divide our treatment into localized therapies and generalized therapies. In the localized realm, we have surgery, which is the cornerstone towards curing most cancers, and radiation. The technology that's permeated the surgical field, I believe you've already had a session on robotics and minimally invasive procedures. Radiation, we have one of the most newest and high-tech linear accelerators that allow us to perform stereotactic radiosurgery, which is pinpointing the radiation beam right where you want it, not where you don't want it, and giving it in doses that otherwise might not be permitted. And when it comes to general therapy, through some of these genetic sequencing tests that we do, next generation sequencing we call it, we're able to find out what kind of medication might work. For example, we might have patients that would benefit from immune therapy rather than chemotherapy. a form of therapy that utilizes the body's own immune system to fight the cancer without causing much of the side effects that chemo would cause. Many times you'll find a mutation in a gene where there's a pill that'll fix that mutation, and once that mutation is fixed, everything downstream from that mutation becomes fixed. So you'll see the tumors and the scans actually get better with very little in the way of side effects.
So people may be getting any of a number of modalities to treat their cancer. When they're working with you, how often actually are they seeing you as a matter of monitoring and maybe making corrections in the treatment regime?
Right. So the first thing we ever want to do with any patient that's been diagnosed with cancer is set up our goals for care. Are we able to cure this individual? And if it's curative treatment, we will typically be seeing them frequently in the early going, especially if they need any of the kinds of medications I've mentioned, like chemotherapy. And then you tend to space them out and set up what's known as survivorship planning, where you're not only monitoring for the specific kind of cancer, but making sure that globally all of their healthcare needs are met. Because if you've cured them of cancer, you want to be sure that they're not smoking and they're getting their screening testing done and so on and so forth. When you have an individual that may have advanced cancer, and that's an area that we've made wonderful strides in, so people are living longer with good qualities of life, we may need to watch them a little more closely and a little more frequently, and we will be seeing them typically, depending on the treatment they're getting, from a few times a month to every few months, and we're typically getting scans on them every 3 or 4 months to make sure that things are still going in the direction we want them to.
Now, if I can take a step back, so once they are diagnosed or they have positive test results, they get referred to you. But are there red flags that patients should be looking for in the normal course of events? I know they would generally go to a primary care physician that something is bothering them, but is there anything that you see as a red flag that at least, maybe you shouldn't be waiting?
Well, the biggest thing is perform all your screening tests. Women should be getting their mammography starting at 50. Everyone should be getting a starting at 40 for mammographies. Colonoscopies starting at 50. Men should be getting their PSA screen starting at 50s. So, and pap smears for women annually. You can't let go of any of these screening tests because they've been known to save lives. If you've been a heavy smoker, you should consider getting a screening CT scan to make sure that your lungs look okay. Go for your annual physicals, and then based on your personal history and your family history, your primary care physician might warrant some specialized recommendations based on your own background, but I'd say your standard screening tests should not go missed.
So, Dr. Bari, patients who've been recently diagnosed with cancer, what advice do you have for them? Because it's a very scary feeling that people are walking away from when they hear that.
Yeah, it's obviously human nature that when you hear cancer, that you suddenly your mortality comes into clear focus, and the mind tends to go down the darkest of paths. I think the biggest advice that I can give individuals is don't approach this from a place of fear. When you're approaching anything from a place of fear, the ability to make clear-cut decisions and decisions that would be in your best interest are not that easy to come by. Educate yourself. The resources that are available today are endless, and that doesn't stop with just Googling things. You need to take that information, sit down with your primary care physician and any person that you see from the oncology realm, a medical oncologist, surgical, or radiation oncologist, and make sure you get clarity on your disease, what to expect from treatment, what the goals are of your treatment, and be able to have that kind of relationship with your treating physician that you can call them when you're not feeling well and when things may not be going the way that you expected them to go. So getting rid of the fear, I think, would be the best advice that I could give anyone that's diagnosed.
Now, when patients come in to see you and you go over the treatment regime, et cetera, maybe there are options as well, but I'm thinking, do they typically ask you, what do you think is the best option for me?
They will many times do that, and they'll ask the question, well, what would you do if it was your, and fill in the blank, your relative. I'd like to say that all the physicians that we work with would say the same thing, that you're always going to make the best recommendation for that specific and individual patient. You not only, there's a science to being a doctor, which is taking all the facts that you have from the data and the studies that you have access to, and then there's the art where you have to individualize it to the specific patient that you're seeing. And once you kind of put those two together, you can come up with an approach that not only helps the patient from a length of life perspective, but will not limit their quality of life during the journey.
Okay, thank you. St. Clare's is about being around the corner, ahead of the curve. Around the corner ties into our being local, so that you don't have to go far for your cancer treatment. And ahead of the curve has to do with the advanced technologies we bring, like the TrueBeam. What do you feel, and what advice for patients, what can they have at St. Clare's locally to take care of their treatment? And perhaps when should they be seeking to go outside of our local area?
So one of the great things about cancer treatment is that it is a treatment that can be done extremely effectively locally. There are just a handful of situations and a handful of interventions that might require a large tertiary center. Everything from diagnostics, the 3D mammography, the quality of our interventional radiologists, our pathology department, and obviously the fine inpatient nursing care that we offer can all be done extremely effectively in St. Clare's. We also happen to have, as I mentioned earlier, a very advanced setup for our TrueBeam radiation services with Dr. Chandra. If someone needs something like a stem cell transplant, or which is something we frequently prescribe to our patients, or they're dealing with a rare entity where we will be the first ones to refer them and get them in to see a leading authority at one of the major centers that are close to us. Outside of those situations, we don't need to really refer outside. Everything can be done close to home, and that's extremely important in this diagnosis because some would say that the support team and the support system at home is as important as the medical team in terms of how well these patients do.
Okay. Thank you, Dr. Bari, and I think the information was extremely helpful. And again, I think patients are going to want to appreciate the fact that in addition to just getting care for the diagnosis, it can be individualized for the specific patients. So viewers, thank you for watching Let's Talk Health. Please look for some future events. You can follow us on YouTube and Facebook, and other information can be obtained on our website, stclares.com.